afternoon. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you so much and welcome to our clinic, the Believing for Baby Open Clinic, every Monday. Please, when you come in, introduce yourself, tell us where you're located, make sure you're properly tuned in. When you come in and you are able to see me and hear me clearly, just give me a thumbs up. My admin is going to stand by. Admin is going to join any moment from now, and we're going to start the clinic. The clinic is going to be 30 minutes in duration, so it's going to be an opportunity for you to get feedbacks from me directly. So thank you so much and welcome. Remember, we are in YouTube, we are in Instagram, we have a page, and we have a group. You can participate in any of the platforms. The clinic is going to be 30 minutes, question and answer. It's tailored for women that will become mothers and guys that will become fathers in 2022. So every Monday, by my break time, we normally have an open clinic that will give us an opportunity to get feedbacks. So thank you so much for coming. As soon as you're settled, as soon as you've announced your name and your location, please go ahead and start asking your question. Now, today we are launching our Super Masterclass for the month of September. We understand that so many of our members are looking for boys. We understand so many are looking for girls. We also understand so many want boys and girls at the same time. There is absolutely nothing wrong in wanting to have twins, boy, girl, in wanting to have quadruplets, boy, girl, quadruplets, or triplets, whichever mix. Now, previously, in our organization, we don't normally feel comfortable discussing gender selection because personally, I believe in girl child. I believe in male child. I believe that girl child is the same thing with male child. But I also understand the need for family balancing. There are so many cultures that need perpetuity. There are so many cultures that the male child will need to be around to continue that family name. So there are different ways of looking at this. Now, I have to soft pedal in my approach to gender selection. Now, because we have so many things people carry about, some people will tell you to do this and you have a boy, they tell you to do that and you have a girl. And over time, we have seen families that got destroyed because whatever they told them turned out to be the different. Now, I've seen a family, the man particularly walked away from the new mother, the new wife, and the baby girl because for some reasons, they told him he was going to have a baby boy. Unfortunately or fortunately, when the baby came, the baby was a girl. This guy walked away from that family. Now, when God gives you a particular gender, thank God, there are some people that are asking for just half a baby. But there is nothing wrong in wanting to have a baby boy. And there is nothing wrong in wanting to have a baby girl. They are all okay. We all have male and female siblings, cousins, relatives. So it's okay. Now, what we are going to do on the 26th of this month is to look at the right pathway. We are going to evaluate different things you've heard about. Then we're going to teach you the right way of achieving gender selection and family balancing. There are so many things you need to understand, and you also need to understand the right way. So we have already started releasing the registration details. I will encourage you to be an early bird. If you have been waiting for this topic, you have already started getting solution. We have a subject matter specialist, someone that has been in this business, someone that has actually succeeded in seeing women have a particular gender. So if you want boy, you want a girl, it's okay. But don't go about it going crazy. Assuming you want a boy and you have a girl, love your girl up, okay? Now, there are so many ways you can still get your boy. So many. So we're going to talk about them on the 26th. So make sure you register today. Admin is going to give you the details. Just register. If you're in YouTube this afternoon, thank you for coming. If you're in the page, thank you for coming. If you're in the group, thank you for coming. If you're my personal friend in Facebook, thank you so much. Now, the clinic is going to open and I want you to start asking your questions. I'll provide you feedbacks. The clinic is going to be exactly 30 minutes. Then I'm done, okay? So guys, go ahead and start asking your questions. It's open clinic. I don't have a topic. I'm just going to be providing you feedbacks using my teaching model. So please go ahead, start asking your questions in real time. Remember, gender selection and family balancing super masterclass. Anytime you see super in any of our master classes, you don't want to miss this. This might be a game changer. This might be the balm in your broken relationship. If you want boy, come, let's show you the right way. If you want girl, come, let's show you the right way. It is possible, but you have to go through the right way. It is not a guesswork. It is not try your luck. You have to do it the right way, then you will succeed. So it's possible. So tell your friends and tell your brothers, your sisters, whoever, if your family is currently messed up because they've written you up because you have baby girls, it's actually unfortunate. Because come to think of it, in our society today, from what I know, girls, ladies, women are just amazing. So if you have boys, don't go begin to treat your boys like they are angels or whatever. Treat them equally. Give them equal education. There is absolutely no difference. But like I said, I understand why you might want to have a boy. Like I'm Igbo. Let me give you an example why an Igbo family might want a boy. Okay? Let me tell you why. In Igbo, if you're a man, you're going to stay in your father's home. Like when you marry and you have your own kids, they will adopt your father's surname. You will be there. The ladies will marry and change their surname and go to a different family and continue that family. So if we have an Igbo family where they only have girls, when those girls marry and they've all gone to their different locations, if we don't have a male child in that family, that lineage is going to stop there. Now, there are so many ways we can go about it. This is 21st century. You can adopt, if you want 5 boys, you can adopt them. There are so many ways. Now, so many people made mistakes in the past. I have a family friend when I was in Nigeria. They had 12 girls. 12. They were looking for a baby boy. Guess what happened? By the time the guy was now very old, he eventually adopted a baby boy. Guess what happened? That guy didn't even have an opportunity to know the baby boy. The baby boy didn't even have an opportunity to mingle with the parents. They both died. Now the 12 siblings now took over looking after the young man. So why am I saying this? Don't go breaking your family. If you want to do this, do it early. Do it the right way. Don't go dividing your family because of baby this, baby that. If you want to do it rightly, do it rightly. Because in this family, guess what? I think from the 8th girl, all the babies from the 9th, the 10th, the 11th were all missed opportunities. The parents wanted boys. Now there are so many people that they don't even hide their disdain with their babies. When they were expecting boys and they have girls, they begin to treat those kids as if they are, the problem. Whatever God give you, please thank God and take it. But if you want a particular gender, come through the right way. We are going to devote our time. We are going to teach you every single thing you need to do. If you go through that right way, you're going to have what you want. Okay? All right, let's continue, guys. Let's quickly knock this off. How can you conceive a baby boy? My sister, go and register for that particular class. You see, we always want to cut corners. I just told you our super master class is on this particular topic, and you're asking me openly. Why don't you come in that particular gathering so you can learn everything you need to learn? So Lillian, go and follow admin and register for that event, okay? All right. Good evening, Doc. Please, what can one do to support successful implantation after optimizing the fertility window? Now, if you are doing the right things, so what are the right things? You're praying, you're playing, you're practicing. Those are the 3 things you need. Now, so long as you're living healthy and we've checked your hormones, one of the things we have to check in regards to implantation is what? The level of progesterone. Progesterone is the pregnancy maintaining hormone. Progesterone is the hormone that will make sure you have adequate thickness of the endometrium. Before then, estrogen and progesterone will make sure at least the endometrium is well primed. But progesterone is the major one that will make sure that the thickness of the endometrium is strong enough to support pregnancy. Pregnancy is like building. When you don't have a thick endometrium, it's going to collapse. So most miscarriages are caused by low level of progesterone. So one of the things we have to do in your own situation, if your pregnancy is naturally conceived, if your progesterone level is okay, then you don't need to do anything. Just make sure you're eating properly, you're exercising, you're avoiding stress, then your pregnancy is going to go good. If you are going for assisted reproductive technique, definitely before you go, we have to have a baseline. So we'd have checked all your hormones, we'd have made sure that your progesterone level is good. If we have any suspicion that your progesterone level is not within the normal range, we are going to give you progesterone supplementation. Very important. This can be in form of suppository, injection, or tablets. Progesterone is very, very important in successful pregnancy. When your progesterone level is not within the normal range, you're going to lose that baby, and it's very painful. Okay? Okay, let's continue, guys. Let's continue. Let's knock this out before we go. Keep asking your questions. Make sure your questions are very straight to point, and I'll give you straight to point answers. We're going to keep it to time. Exactly in the next few minutes, I'm going to be done. Okay, guys, let's see. Where are the questions? Okay, this person is asking, what does it take to register for the Super Master class? Follow my admin. Admin, please share the details for her, okay? Tell all your friends that have been wondering the right way to get a particular gender. Tell them that in Snowspirations on the 26th, we are gonna go there. And when I tell you I'm gonna go there, I will go there. I always look for the best. When you show up, you're gonna learn. Now, it's up to you to go back and follow the method we're gonna share. Okay, but it works. It's possible to have a particular gender. Okay, let's continue, guys. Let's continue. Where are your questions, please? Okay, I've already answered that. So let's go. Let me go up. Okay, let's see. Okay, Doc, what causes always wanting to throw up after every meal? Now, if this is something that started acutely, that means you didn't used to have this and it just started. It's possible you might have problems. It's possible you might have some GI problems, gastrointestinal problems. Now, if you are pregnant and you are having this feeling, it's part of the things that present when you're pregnant. Completely normal. Okay, so when you have vomiting or when you have nausea, that's like the feeling that you want to vomit. It means that your gastrointestinal system is kind of, struggling to maintain the normal environment. So your gastrointestinal system starts from your mouth and ends in the anus. Okay, so anything that irritates it and makes it not to be in a good place will lead to what we call anti-peristalsis. So when someone is vomiting, you are going against the normal structure in your body. Peristalsis is the force that makes sure that whenever you eat food, it goes down. So when you're vomiting, you're going anti-peristalsis. So if this is a new symptom you are noticing, and it's been happening over and over again, ring your doctor, go in and see your doctor. There is no room for guesswork in gynecology. Sometimes things you might be waiting to figure out by yourself might be a sign that something difficult, something severe is happening in your body. So we cannot afford to waste time in our life. Some of the things that might be leading to this might be a growth. It might be benign, it might be cancer. So we need to go on time and find out what the problem is. Okay? All right, guys, let's continue. Ask your questions, please. Ask your questions. Dr. Ndiche is in the house. Thank you so much. She's also going to be providing feedbacks. Now, if you happen to be in any of these locations I will mention, you can actually be referred in real time. Abuja, Asaba, Awka, Benue, Calabar, Enugu, Jos, Kano, Kogi, Lagos, Nnewi, Osun, Owerri, Port Harcourt. If you live in any of these locations or you are in the neighboring cities, we can refer you. You can see SGHS certified, verified, evidence-based practitioner. Majority of them are fertility specialists. So if you don't have a fertility specialist and you want to be a mother and you want to be a father in 2022, and by September, you are not pregnant at least, my sister, you need help. The earlier you get help, the better, especially if you're above 35. Let me tell you why. I don't sugarcoat. I tell you the way it is. Let's be very frank right now. My sister, if you are 35, as we're talking right now, when we go to your ovaries, the number of eggs that God originally designed for you, you have about 400 eggs that you will select the best to have your kids. If you're 35 and above, by the time we go to your ovaries, the numbers have reduced though, drastically, both in quantity and quality. So you have fewer eggs to use. So you should be worried, but you should be worried for the right reason. The problem is, most times we worry, and in cause of our worry, we don't take action. And the worry will pile up, and it will keep building up tension. Let me tell you the bad pathway about infertility. If you're not careful, infertility will go and steal your joy. And one of the areas infertility will steal your joy is your sexual life. So if you have low libido and you are supposed to be making love for 8 hours, will you make love? No. Will you want to make love? No. But how do you become pregnant? By making love. So there are so many relationships that are having infertility problem today because they're no longer making love, because they no longer fancy making love. When your partner is coming from south, you're running away. Meanwhile, this is what you guys need to do. And we can solve this problem. Okay? Okay, let's see. Okay. Good day, doc. Please, can someone get pregnant with water coming out of one of the breasts when pressed, even when the prolactin level is normal? Yes. What we are interested in your prolactin, it's the normal level. Okay? Now, some women can have what you are having. It's called Galactoria. Galactoria is the expression of breast milk from your breast when you're not pregnant or breastfeeding. Once we check the level of your prolactin and it's within the normal range and you are ovulating, you can become pregnant. Now, there are so many other factors that might not allow you to become pregnant. So stop focusing on the breast. Most women make mistakes on focusing on the wrong things. So many women, 99% of you, anytime you don't see your bleeding, you are freaking out. That's not good though. You can still become pregnant when you haven't seen your bleeding. Seeing your bleeding is evidence that good things are happening. But the fact you're bleeding doesn't necessarily mean you're ovulating. So many women that are not bleeding are ovulating and they can become pregnant. So many women come to the doctor, what can you do for me for my bleeding to start coming out? My problem is not whether your bleeding is coming out or not. My problem is if you are ovulating. That's the only thing I want to confirm. Because once you are ovulating, whether you're bleeding, whether you're not bleeding, you can become pregnant. So when you don't see your bleeding in a month, it's okay to be worried. Now, when you worry, what do? You go to a gynecologist. We need to find out why. Sometimes it's age, sometimes it's stress, sometimes it's other things, sometimes your body weight, sometimes it is your body loss. Any of those things can lead to lack of bleeding, which is called amenorrhea. But stop focusing on only bleeding. There are so many women that will subscribe. They will tell you, doc, what can I do to start seeing my bleeding? Your bleeding is not just the mark of becoming a mother. Your bleeding, it's part of it. It's not everything. We need to make sure you can have your baby. And the only person that can help you figure out if you can have your baby or not is a fertility specialist. My sister, my brother, this is September. If you don't have a helping hand, we can help you. If you don't have a fertility specialist, we can refer you. You can suddenly become pregnant in September. Today is the 6th. 6th. You have a lot of time to defeat infertility. You can have your twins, you can have your triplets, you can have your quadruplets. If you decide that enough is enough, then you get up and do something. Okay? Let's continue. Someone who's supposed to miss her period, her period came on August 20th, and missed. When can you start your ANC? So my sister, what I have to ask you is this. Have you checked for your pregnancy test? That's the most important thing I need you to do. You see, sometimes we worry a lot. And when you worry, you're increasing the level of your stress hormone. And when you're increasing the level of your stress hormone, you're not helping yourself. So many women, if they are not worried, their pregnancy will go okay. But when you worry a lot, your blood pressure is up, your stress hormone is all over the place, and they can lead to problems. So my sister, if your last menstrual period was in 20th of August. Today it's 6th. So what you need to do is to go and check your urine pregnancy test. Then go for blood test. We check the beta HCG. Pregnancy is not an assumption. Pregnancy is either you're pregnant or you're not pregnant. So if you have checked your pregnancy test with blood, not just urine, you have to actually do the 3 of them. Urine, blood, and ultrasound. Once you have confirmed that you are pregnant by blood, then call your doctor. The earlier you register for ANC, the better. I understand so many locations will want you to. Some people will say, but doc, they told me to come back by 20 weeks. You can't report to your doctor for the first time by 20 weeks. It's already late. So the earlier you register for your ANC, the better. And guess what? We also have our virtual ANC. So all pregnant women in this group, if you want us to run with you, please follow the admin, run to the admin. It doesn't matter if you're first trimester, second trimester, third trimester. We need you to be in our ANC lounge so we can work together to make sure your baby is fine. We don't just want you to become pregnant. We are not just going to help you to become pregnant. We want to help you to become pregnant, then have smooth pregnancy journey so that you can have your own baby. Today, we lost one of our babies at 16 weeks. Very painful experience. And this lady did everything possible, but she had early contraction. So we are in a mourning mode in our ANC, but it's okay. She did everything right. Sometimes we do everything right and we don't get good outcome. But some people don't even give themselves the chance. Some people don't even know what to do when they have some problems in pregnancy. It is not okay to sit on the fence when you're pregnant. Please come, let's walk with you. It breaks my heart anytime I wake up and I hear that a baby died. I don't care how old that baby is. All women, all mothers, all babies deserve to have that relationship. Every singular pregnant woman deserves to see her baby. Every singular baby deserves to see her mother and her father and her siblings. This is why we need to be careful. Very important. We cannot afford to lose any of our babies again. And there are things we can do about it. There are so many things we can change. Okay, let's continue. You always start farting anytime you enter your fertile week to your period. Please, what could be the cause? Completely normal. When your hormones are changing, especially progesterone, progesterone can produce a lot of gas. So you can notice you have a lot of bloating and you fat. So it's okay. So long as you're targeting it within the particular period, it's pretty much okay. And when you notice this within a particular period in your cycle, then that's completely normal. Some women will have what we call PMS, premenstrual syndrome. So within the time your period is gone, so many changes will happen in your body. Like if you pay attention to your body, you will notice that you'll begin to have breast tenderness by the time you're bleeding or by the time you're ovulating. Your breasts will start being heavy. You will start noticing a couple of other changes in your body. They are completely normal. Okay? All right, let's continue, guys. Let's continue. Let's knock this off. I have 7 more minutes. Okay, let's see. Please, can one do progesterone test on the 22nd? Yeah, 22nd and 21st is okay. But guys, let's always be compliant, okay? If we tell you 21 days, please show up on 21 days. 22 day, 22nd day is still okay, but we prefer 21 day for a particular reason. So please, if you miss it, call your doctor. Matter of fact, you want to know the truth from me? You can skip this one and count again and go back at 21 weeks. We always want to be accurate. We always want to be reliable when we are looking at the hormones. Don't go start doing things by yourself and you expect good outcome. When we tell you 2 to 5 days, when we tell you 21 days, there is a particular reason why we want to do it at 21 days. But we love to jump corners. This is one thing I've noticed about us. We want to just do things by ourselves. And we also want to get good outcome. But you can't do the wrong things and you have good outcome, my people. When you see a doctor and a doctor gives you instructions, try as much as possible to go by that instructions, 100%. The same way you obey your pastors, obey your doctors. It's for your own good. Okay? If your questions are not answered, please ask again. Admin, please repost any other question I've missed, and Dr. Ndiche will also provide backups. Okay, so I've already answered that. Okay, I've answered that. So I'm going to assume, okay, let me go down. And we have about 5 minutes. Everything you need in regards to subscription, admin is sharing that. Okay? We used to have a provider in Ghana. Unfortunately, the provider in Ghana didn't honor our memorandum of understanding, our MOU. But we are working on Ghana. As soon as possible, we're going to get Ghana provider again, okay? I would rather have nothing than to have somebody that is not reliable. So I don't just want to send you to anybody. I want to send you to a doctor I can query. There is nothing wrong in querying each other. My colleagues can query me, I can query them. We can discuss things professionally. But for any reason, I stand with my people. So when I'm sending you to a doctor, if you go to that doctor and probably you felt the doctor wasn't treating you the right way, come back to me. Okay? When we refer you to doctors, our doctors are the best. They will respect you. They will discuss your case. They will give you a copy of your report. They will explain to you what's going on. So many people will just collect your money and they tell you nothing. We don't want that. So we empower you when you go to any of the doctors we are referring you to. Have a conversation with them or ask them all the questions. They must give you answers. So they must. Our doctors, SGHS doctors, to educate us. So we look for the best. I would rather have only, like in Lagos, I have just one doctor. In Abuja, I have two. So I would rather have only one. I have trust and confidence, and we trust each other, and we co-manage, than to have so many, and they are just there doing their thing. Especially in Nigeria now, so many doctors are leaving. Doctors are on strike. We need to be careful. Now, let me warn you. If you are pregnant, and you're in Nigeria, and you registered in a government hospital, and that hospital, the doctors have gone on strike, I don't want to hear any stories that touch the heart. I was going, I was coming, and I got caught up in the traffic, and this happened. What's the end product? I lost my baby. I do not want to hear that. If you are in a government hospital and they have gone on strike, please don't stay under the matron. Don't stay under any Eliza nurse there. Please go to the private hospital. Go to the private clinic. If you need to spend extra money, please spend extra money. We cannot afford to hear that your baby died because nobody attended to you. No. If the doctors are on strike, you switch. The biggest thing that will happen to you in your life is to have your baby. We cannot afford to hear that women were delivering. Last week, a woman that looked for a baby for 5 years died, and the baby survived. We can't be hearing those stories again in 2021. It's just imagine that baby without a mother. Just imagine that husband. Just imagine that family. For things we can stop. So my people, over the weekend, so many of you spent a lot of data and money talking about Big Brother, talking about people's celebrities' life and stuff. But you don't spend money on your health. You are pregnant. You are not attending the best ANC in your location. That's not right. That's not right. If you have to spend extra money to go to the best, please go. But start with the virtual ANC. All pregnant women in our group. I've noticed a trend. Look, I tell you the truth. And sometimes you might not like my truth, but I will tell you the truth. What I've noticed, so many women will show up. Some of them will practice PPP. Some of them will succeed by themselves. Some of them will subscribe. By the time they are pregnant, they vanish. Their aim is to just become pregnant. They won't sign for ANC. Now, when they begin to have complications, they come to the inbox, which is the wrong way, and they begin to tell you about their complications, which at that stage is already late. That's not the right thing, my people. If you spend 10 years to succeed in becoming pregnant, my people, it's 9 months. Protect your pregnancy. Don't just show up and give me the negative news. I don't like negative news in my inbox. It freaks me out hearing that a baby died, hearing that a mother lost her baby at 40 weeks, 38 weeks, 36 weeks. It's not right. It's heartbreaking. Whenever any of your baby dies, a part of you goes. No two babies can be the same. You might not like this message, but the reason why sometimes you see me, and some of you will say, but Doc, why are you angry? Why are you? You just don't understand. You don't understand how it feels to lose a baby. It's the worst experience you can ever have as a human being. Certifying in Kemi is there, she can attest. In Air Force Hospital, the worst thing that will happen to you is to certify that a newborn died. You'll be the doctor on duty, you certify dead. It's heartbreaking, my people. Come on. We can do better. It is tough to achieve pregnancy in 2021. So when you become pregnant, be wise. Be wise. Protect your baby. Protect your baby by all means possible. Have a doctor attached to you. Have someone you can call by 1 a.m., 2 a.m. And I've sent so many people to the ER in this group. And we have saved thousands of babies. Oh, doc, I'm bleeding. Water is coming out. Pain is in my way. I'm waiting for money. What are you waiting for? There is no night. There is no day. There is no morning. In pregnancy, you must go to the hospital. And you cannot go to a hospital where you will go, they say doctors are on strike. We don't want to hear that, my people. If you are registering for your ASC, you are going to the best doctor so that if anything happens and you need to go for emergency, we can easily take care of you. So many women die because they could not get a CS on time. It's preventable. Let's get it right, my people. Okay? Be your baby's first advocate. You see, as a doctor, it's what you tell me I will work with, or what we examine, or what we see in the lab. But guess what? As the baby mother, there are so many things that the doctors don't even know. You know how your baby is kicking. You know whether your baby is sleeping. You know whether your baby is happy. It's your baby. You feel it in your belly. You know you are your baby's first doctor. There is something called instinct. Babies just don't die. Most babies that died, if their mothers were wise, they will know when that baby died. So many pregnant women are carrying dead babies in their belly. They didn't even know the baby is no longer viable because you're not doing the right things. Some of you are still taking alcohol. Some of you are still messing about. Some of you are just not doing the right things, and you want good outcome. And when it happens, you begin to complain. No, my people, you be a mother hen. Go and monitor animal kingdom. Some of them can have 12 babies and they can protect their 12 babies. The worst thing that will happen to you if you go to the village is to go to a new hen that recently hatched her chicken. You're finished. She will protect one singular chick by everything in her. This is what human beings should be doing, but we are not doing it. We are mising. We are saving fashion. We are buying cars. We are buying jewelries. We are doing things, but we don't go to the best for our babies. It's not right, my people. You can write millions and thousands of social media posts. People can come and tell you, amen, you can go and live in the church. When your baby dies, your baby is dead. Let's stop that from happening. So if you are pregnant, my people, please go and register for your ANC. Now, if we told you you need to go for CS, don't even query it for 1 second. In the past, before we started this group, so many Hebrew women died. So many Nigerian-based Hebrew women died. Why? Because they were waiting to give birth like Hebrew women. And they were supposed to just be sectioned and they have their baby, but they died because they wanted to have CS they wanted to have vaginal delivery when vaginal delivery was not your option. Not every woman will deliver vaginally. Some women will deliver vaginally. Some women will need augmentation. Some women will need labor induction. Some women will need CS. Some women will vacuum delivery. Whichever one that works for you, please go. Please. Okay, my time is up. Please make sure you register for the gender selection. If you have been freaking out, dog, how can I have a baby boy? How can I have a baby girl? It is possible. You can actually combine your assisted reproductive technique. So even when you don't have a baby for 20 years ago, 15, 10 years, you can actually have your 4 babies and it might be the gender you want. You can actually have your twins and it might be the gender you want. It is possible, but you need to know about it. So go and register and we'll see you halfway, okay? So later this evening, I'm going to talk about adoption. What will happen when adoption is the only option you have? We're going to talk about it this evening. And for now, I'm going to take my leave. Please, let's prioritize our family. If you want to be a father, if you want to be a mother, this clinic is for you. If you don't have a baby, and if you have not tested positive as of today, you need help. You can't go alone. Come, let's help you. Okay, so God bless you and thank you for coming. I'll see you guys later this evening. Thank you so much, admin. Thank you, Dr. Ndiche, and everyone that helped today. I'll see you guys, and until I see you, God bless you, and bye-bye for now. Okay. Can Clomid make you ovulate? Sperm catches. Clomid can lead to a state of super ovulation, but it has to be prescribed by your doctor. Clomid can actually also lead to multiple pregnancy, okay? But your doctor has to be the person that will do that. You're Igbo, you need my phone number. My sister, if you subscribe, definitely. If you want us to speak Igbo, we speak Igbo, okay? I speak Igbo very well. All right. I'm just quickly trying to knock off other questions that came up. Okay. Guys, my time is up. Yes, we're on Instagram. Admin, share the Instagram link, okay? I always want to make sure that everybody's attended to. That's why I'm spending extra minute. So let me go up. I'm sure Dr. Ndiche already took care of them, but let me quickly go up and make sure we are all good. 6 months is the prime. 3 months is classic. 1 month is basic. 1 week is light. When the appropriate time to run ovulation test, go to your gynecologist. He will decide. You don't go to the lab by yourself. You're wasting your money. Don't try it again. If you did it in the past, stop. Okay? All right. Okay, guys. Thank you for coming. I'll see you guys later this evening. Bye-bye for now.